And so I've been asked to talk a little bit about funding from the perspective of one of the UKRI funding councils. And so I'm not going to say a lot about EPSRC. I'll presume a little bit of knowledge, but I guess the very quick is that we fund research in universities. We provide support for postgraduate training. For those of you that aren't familiar, please do get in touch. We're always happy to answer questions. So what did I think I'd talk about in my very whistle-stop tour? Say something very quickly about our new strategy, something about the portfolio that we support, which won't at all do justice to the fantastic range of projects and programmes, and then something, because we are a funding council, about current and upcoming funding opportunities. So this is our new strategy. It was published just over a year ago, following a lot of great conversations, a lot of community input from the universities, from clinicians, from healthcare professionals, some from industry, and it's a start of a conversation. We've set out a direction, we've identified some priorities, and we've identified some things that we're particularly keen to work with the community to see how engineering and physical sciences can contribute over the coming years. We published a summary from the notes. We took the strategy out on the road just over a year ago and went around the country to say, well, how can we turn this strategy into practice? What are the short-term priorities? What would good look like? What would fantastic look like? What are some of the issues or challenges or problems that we need to be able to overcome if we're going to really both deliver new research and get the best value out of the research that we are able to support and help it, you know, expedite on its onward translation journey so it can really benefit. And the action plan that sets out some of the things we're going to do, our initial actions, will be published very shortly. So this is our portfolio overview. As you can see, we support shy of £300 million. This is research that says it's relevant to health. Of course, if you look across the wider EPSRC portfolio, you may well see other things that are of interest, even if they're not currently focused on health applications. And by that, I mean things such as AI. There is some represented in that portfolio, but there is a large AI program. Quantum technologies, the up-and-coming technologies which are here, and a lot of people think will transform a lot of our future. Robotics, materials, mathematical modelling, statistics, so there's a lot more. So that is a significant but only part of what EPSRC does. And we have a lot of support from project partners. We always say the cash is great. It certainly adds value, but the intellectual input, the skills, the knowledge, and the access to facilities and resources are really what turns some of these projects, I think, really into, it really does help them to deliver their potential. And we have a lot of partners. This is in addition to the partners that projects and programs support, both internationally, regionally, and globally. So it's a very, very diverse portfolio. We're a national funder, so you will see a little bit faded, but we do have funding the sort of, throughout the UK. But there's a lot of untapped potential and a lot of talent. So a lot of what we like to do is to say, how after we've given funding, can we then connect up other parts of the ecosystem to work out where we can support new partnerships and new networks. And this is some of the activities that I use using the very sophisticated medium of Google to say, if you were trying to say some of the things that are relevant to sort of surgical technologies, these are some of the things that we have funded currently. But of course, research doesn't have a sort of an expiry date. So there's the research that we funded, that our funding may have come to an end, recently or even, a few years ago, that is still really, I think, relevant and ripe for exploitation and is woven through various applications throughout the ecosystem. So there's smart medical imaging, there's robotics, there's digital twins. So there's a whole range of technologies with a whole range of application areas. Some of these are through large programs, some are supported through networks. You'll see there's a centre for doctoral training. The timing was such that this was just ahead of the announcement of the new set of doctoral training centres, which will be up and running in the next year and will be recruiting for students. 8 of those are very much focused on health, but of the 65 in total, they provide, I think, a range of really exciting possibilities for people who want to pursue a career in research. And so what I said that we were keen to do is to put the strategy into action. So one of the first competitions we announced when the strategy was published was an investment. We call them research and partnership hubs for healthcare technology. And this was, if you like, an opportunity for the community to self-organise around existing strengths, but also look to where we as a country wanted to build and secure strategic capability to help us deliver our vision of transforming sort of healthier lives for all. That competition is due to be concluded very shortly, so I can't yet tell you the results. We haven't interviewed. But those hubs will all have partnership funding associated with them. So even if you're not part of one of those hubs, we really hope and encourage people to work with them. And if those hubs are successful, we also intend to work with them and look to fund them for the longer term. And subject to the budget, we would very much then like to identify where there are gaps or opportunities and maybe take, a less sort of self-organising way to where we might identify and fund additional hubs in the future. We funded a number of digital health hubs. I've heard digital health mentioned a lot over the course of today. We fund a lot of digital health across EPSRC, as you would imagine. This is only part of it, but these hubs, we describe, they're about bringing together expertise to provide training, very much with a sort of a co-collaboration, co-design ethos. They are very keen to work with new partners, so they're open to conversations, to sharing their ideas, to providing resources, expertise, training. So please do get in touch with them. The details are all on the slide. And talking about upcoming funding opportunities, there's a few. Just gone live, transforming prediction and early diagnosis with the focus in the community and thinking very much about health inequalities. I didn't mention it when I shared our strategy, but one of the things that we're really, really keen on to embed throughout the portfolio is public patient engagement and involvement, and this is very much highlighted in this opportunity. I also mentioned Healthcare Technologies Connectivity Awards. This is something a little bit different. We recognise that great collaborations take time to seed. They require people to understand the environment, to find the individuals that they want to work with, and that needs resources, it needs time. This is an opportunity for people to apply for themselves, maybe their team members, to spend time in a new environment and to start to develop those ideas, drawing on engineering and physical sciences. And we've also agreed that we're going to work with our colleagues in the Department for Health and Social Care, NIHR, the research arm of DHSC, to fund some new networks to bring together. There's a lot of ideas, people already working on different aspects of this, and we're really keen to build capacity and to encourage new collaborations. And the difference between a network and a network plus, for people that don't know, is a plus has some research funding associated with it. So that's an opportunity for people who are interested in thinking about how we novel tools and technologies to support people living with dementia to have sort of independent lives. And not yet finalised, but soon to be finalised, is something that we're calling our translation partnership, where we're looking to build on research and take it closer to translation, and encouraging people to work with business and clinical partners to really go from beyond the sort of the early stage research funding much closer to the edges of what EPSRC can fund. And of course, EPSRC operates an open all year round. If you've got a great idea, please do apply for it. You don't have to wait for a funding opportunity that's ideally mapped to your needs. Finally, if you want to find out more, we do have a newsletter which we produce about 4 times a year. The UK Funding Finder is the one place to go where all the funding opportunities, both sort of, the pre-announcements and the announcements you can find across all of UKRI. A question we get asked quite often is it suitable for EPSRC funding? And this is the purpose of our remit query function. If you're not sure if it is EPS, please do submit a short form and we'll get back to you and steer you to the right place where your proposal can get the best attention. And of course, do get in touch.